The heart beats because of electrical signals that travel through its muscle cells. These muscle cells are called cardiac myocytes. Each heartbeat starts with a signal that changes the electrical charge inside the myocytes. This is called the cardiac action potential, and it's what we see reflected in an ECG. Let's break it down step by step. Action potential happens in phases based on how sodium, potassium, and calcium move in and out of the cell. Phase 4. Resting. The myocyte is at rest, ready and waiting. Potassium ion stays inside, sodium ion stays outside. So inside the cell is more negative than the outside. This is the flat line before any wave appears on the ECG. Phase 0. Depolarization. A signal arrives. Sodium channels open and sodium ions rush into the myocyte. The inside becomes positive. This causes the muscle to contract. This is shown as the QRS complex on the ECG. Phase 1. Brief repolarization. Sodium channels close. A small amount of potassium ions leaves the cell. The charge slightly drops. This phase is short and not easily visible on the ECG. Phase 2. Plateau phase. Calcium ions enter slowly. Potassium ions continues to leave. Electrical charge stays balanced for a while. Keeps the cell contracting. Seen as the ST segment on ECG. Phase 3. Repolarization. Calcium stops entering. Potassium keeps going out. The inside of the myocyte becomes negative again. This lets the muscle relax. This phase creates the T wave on the ECG. Let's summarize this. In phase 4, myocyte is at rest. ECG shows flatline. In phase 0, sodium and causing depolarization, ECG shows PQRS complex. Phase 1 is not visible on ECG. In phase 2, plateau with calcium, ECG shows ST segment. In phase 3, potassium out causing relaxation, ECG shows T wave. Each of these electrical changes happens in every heartbeat, and that's what we record in the ECG.